Hi everyone, today I am giving you information on the topic rheumatoid arthritis. This one is the part 4 of the arthritis, in which I will explain you about how it get converted into a systemic illness, how it affects the different parts of the body. So let's see its effect on the different parts of body. So it affects our eyes, mouth, skin, heart, bones, fingers and toes. So let's see one by one. Eyes. Dry eye syndrome, which can lead to ongoing irritation and damage to the cornea. Okay, so it gives birth to the dry eye syndrome, in which the dryness takes place inside the eyes because there is a layer which is present on the cornea, okay, which lubricates the cornea. So when we close our eyes and open our eyes every time, then it will doesn't cause any damage because there is a liquid present which lubricates the eyes. But in case of dry eye, that liquid doesn't function properly, and due to which the irritation takes place and our cornea starts damaging because continued wear and tear takes place, because the upper lid as well as lower lid performs the function of the closing as well as opening the eyes. Next one is the scleritis. Sclera is basically the whitish part of the eye, and the inflammation of the sclera takes place. Okay. Next one is the glaucoma. It also affects the optic nerve and the loss of vision. Optic nerve is a nerve which connects our eyes to the brain, and the function and the information is given to the optic nerve. Optic nerve will send the message to the brain that this image is seen by the eye, and then we are able to see. And one of the more function of the optic nerve is to maintain the pressure of the eye, okay. And then the loss of vision takes place. Glaucoma is basically a kind of disease in which the peripheral vision starts decreasing first, and then it affects the central vision also. So this disease affects the optic nerve of the eye. Next one, cataract, which results in the inflammation of the optic lens. So as we all know that the crystalline lens is present inside the eye, so inflammation of that lens takes place, due to which the cataract develop inside the eye. So rheumatoid arthritis, in this way it affects the different parts of the eyes. Next one is the mouth. Now dryness takes place inside the mouth also. Chronically it leads to the tooth decay, okay. Tooth gets decay due to the dryness. Next one, difficulty in eating as well as swallowing. It creates very difficult for us to eat as well as swallow the food. Respiratory infections takes place. Tuberculosis takes place, which is the TB. Next one, lung nodules and the scarred lungs. So these are the things which are related to the rheumatoid arthritis, how it affects the mouth also. Next one, skin. Harmless red dots are present on the skin. Ulcers on the legs or the under nails are present. Slowly wound healing. If any wound takes place in the body, it takes a long time to heal. Inflammation of the small blood vessels. Small blood vessels get inflamed. Next one, medications cause skin rashes. Those medications, those medicines which we are taking to slow down the process of this disease, the progression of the disease, so these cause the skin rashes, okay. Next one is the heart. If plaque, fat deposition builds up and blocks the artery or the another blood vessel, heart attack and the stroke is the result, okay. So if any fat get deposit on the any artery of the heart, it blocks that artery, which results in the heart attack as well as the stroke. Next one is the anemia, and it harden the arteries also. Next one is the bone damage the joints, okay. So when the two bones get joined together, they will affect the joint. Bone weakness, bones gets weak. Wear and tear during movements. When we move our bones, in case of this disease, wear and tear, there are the chances of wear and tear, and there is a chances of risk fracture is there. Next one is fingers and toes. Now how if it affects the fingers and toes? Fingers abnormalities, toes deformation, okay. The shape of the fingers and toes starts changing. Deformity of a bone and the shape is changed. Cold hands and feet. The patient will feel that the hands and feet are cold. Next one is the numbness, okay. The body parts start numbing. Nerves and cause numbness. Nerves, it affects the nerves which cause the numbness. Thick skin tend to develop as the shape of the foot change. As the shape of that particular joint takes place, the skin becomes thick. They can lead to ulcers if the person cannot receive treatment. If person doesn't take any kind of treatment, then it leads to the formation of the different ulcers. So in this way, the rheumatoid arthritis affects the different parts of the body, and it is very important for each and every person that if you have any kind of systemic illness, it is very important to control it. Thanks for your patience listening.